Mental health is an indispensable component of health. Brainstorming further, the key questions which crop up include: what exactly is mental health? Why is it important? Whom does it impact? World Health Organization has defined mental health as, in simple terms, mental health is being productive, able to contribute positively, able to cope with hassles and stressors, and maintain relationships. All of these enable us to lead a meaningful and fruitful life. In this positive sense, mental health is the foundation for well-being and effective functioning for an individual and for the community at large. Mental health is more than the absence of mental illness. Mental health implies fitness rather than freedom from illness. There are multiple factors from biological, psychological, and social domains which can influence mental health. These factors can individually and collectively play a complex interplay and make an individual vulnerable to simple as well as serious mental illness. Let us look into a typical scenario to understand this complexity. A lack of meaningful employment may be associated with depression, alcohol, and drug use. This may in turn result in road trauma, the consequences of which are physical disability and loss of employment. Mental, social, and behavioral health problems may interact so as to intensify their effects on behavior and well-being. Substance abuse, violence, abuse of women and children on one hand, health problems such as heart disease, depression, and anxiety on the other are more prevalent and difficult to cope with in conditions of high unemployment, low income, limited education, stressful work conditions, gender discrimination, unhealthy lifestyle, and human rights violations. Complex etiology makes the management complex and need for individual customization. One size fits all does not work in mental health most times. The essential links between biological, psychological, and social factors in the development and progression of mental and behavioral disorders instills hope for millions. Mental illness can affect anyone. Mental illness quite commonly begins at childhood or adolescence, and some having long-standing or relapsing course and can leave behind significant disability. Moreover, the most productive years of life are lost fighting mental illness. Mental illness can cause significant strain on the family or the primary caregivers. Now coming to the crucial question, is mental health a public health issue? Mental health is definitely a public health issue. To highlight this fact, let us look into the three dimensions. Number one, importance of mental health. Mental health is the basic foundation of one's overall well-being. The presence of mental illness can precipitate or worsen some physical illness. In simple terms, there is no health without mental health. Number two, it's the impact of mental health. Mental illness is common. 1 in 4 adults are affected by significant mental health issue. Looking at the global disease burden, if the existing trends continue, by 2020, 15% of the global disease burden could be due to mental illness, with depression being the major contributor. Lastly, mental illness is one of the most important causes for premature death. Severely mentally ill population have a 10 to 25 years reduction in life expectancy. The possible reasons could be significant comorbid medical illness like diabetes, cardiovascular illness, and others, delayed or neglected professional care, compromised self-care, and of course suicide. The prevailing stigma and lack of awareness only compounds to these problems. Any public health issue needs investment. Let us understand the possible reasons for the need to invest in public mental health. One of the most important reasons to invest in mental health is due to the availability and effective economic treatment options for the magnitude of mental illness. Any investment into mental health could provide tangible as well as intangible gains. Hence, it is important to look up into these factors while deciding on the effectiveness of a public health intervention. Implementing, executing, and sustaining a public health intervention can be possible only when backed by adequate resources. Funding or investing being one of the most crucial inputs. Public mental health faces many challenges. The important big challenges of public mental health are: mental health is an area which is underinvested and neglected. The current funding towards mental health program is less than 2% of the overall health budget. Lack of awareness and stigma has been the biggest barriers to seek mental health care and also has led to worst human rights violations. Compounding these challenges is the lack of manpower in the form of trained mental health professionals. India is battling with less than 4,000 psychiatrists for a population of more than 1.27 billion. Who can address these challenges? Who can be a public mental health champion? The answer is mental health is everyone's business. Anyone can be a public mental health champion. Moving away from the traditional belief that the two key stakeholders in mental health are the treatment provider and the receiver, it is important to include the other equally important stakeholders as public mental health task force. These include affected and their families, service providers, policy makers, and researchers who need to work together to make a difference. So, be a public mental health champion. Let's leave behind world a better place.